Hello, I am Dr. Harsha Reddy. I am consultant obstetrics and gynecology. I practice in Cloudnine Hospital, Sarjapur branch and the Bangalore branch in Bangalore. Changes which happen in the breast are evident in a lady who is pregnant for the first time compared to somebody who is already breastfed. So there are a lot of changes which happen in the breast and the nipple and the areola. One of the first signs which are evident is increase in size of the breast, which is evident very early in pregnancy as well. This is due to the growth of the ducts, growth of the glands, the sacs where the milk is produced, as well as increased growth of the tissues which supports these structures. There is increase in blood supply to the breast, which is evident by the bluish veins or bluish lines which are present underneath the surface of the skin. The axillary tail of the breast, which is a projection from the breast towards the armpit, can also become prominent, and in some instances it could be a little painful as well. Stretch marks can also appear on the breast, which we call as striation, due to stretching of the cutis. The nipples become larger, they become more erectile, more centrally placed and deeply pigmented. The areola also becomes darkened and deeply pigmented. Now there are a lot of sebaceous glands which are present in the areola. These sebaceous glands can become very prominent, and we call them as mongomeary tubicles. They are usually about 5 to 15 in number, and they can become circularly placed around the nipples, which is normal. These sebaceous glands are very important because their secretions helps to keep the nipple as well as the areola moist. There could be an appearance of an irregularly pigmented area with irregular margins around the primary areola, which is called as a secondary areola. Secretions can also be seen in the breast, and this is seen as early as 12 weeks of pregnancy. It can be expressed from the breast as early as 12 weeks, that is 3rd month, and that time the secretion is very sticky. And by 4th month, that is at around 16 weeks, the secretion becomes thick and yellowish. And in the latter months of pregnancy, even colostrum can be expressed from the breast. Because of all these changes, what are the symptoms a woman experiences very early on in pregnancy, especially in the first trimester, is a sensation of fullness of the breast, a sensation of heaviness of the breast. She can feel a tingling or a pricking sensation. There can be a soreness in the nipple as well. So what is the advice which we give them is wearing well-fitting, right-sized, firm cotton bra, changing the bra regularly on a daily basis, keeping the breasts and the nipples clean while taking a bath, that is, gently massaging the breast with some oil as a coconut oil, olive oil or a vitamin A based ointment. If the nipples and the areola are becoming dry and cracked, you can massage those areas with this oil as well. If there is a flat nipple or an inverted nipple, the doctor will advise you how to pull it out while taking a bath. If you have hair in that area, you can shave the hair as well. So if some people have a lot of pain, especially in the first month, the simple well-fitting bra usually helps, but if that doesn't work out, they can also try using ice packs.